keeping a close eye on an outbreak of shigellosis. Dr. Ann Pabutsky, territorial epidemiologist at the Guam Department of Public Health, says the number of reported cases is increasing.
We've had a total of 29 cases all of last year, and we're already up to 15 in the first 4 months of 2019. That's why we're bringing up this issue.
Most cases of shigellosis, an infectious bacterial disease caused by the bacteria Shigella, affect children under the age of 15. Some, even less than 5 years old, have been rushed to the ER and hospitalized.
2/3 of the cases are children. 1/3 of those cases are children under 5, and those are the children who are most at risk for Shigella, which is a bacterial infection that is caused by exposure to Shigella through someone who's sick, and it's usually through fecal material.
People usually get sick after putting something in their mouth or swallowing something that's come in contact with contaminated stool. Symptoms can include diarrhea, fever, and cramps, though shigellosis can sometimes go unnoticed.
And some people won't have any symptoms at all. They can be just carriers and spread it to other people, but it's prevented by careful hand washing, soap and water, especially if you're sick. You shouldn't be preparing food for anybody else.
While 4 cases are still pending investigation, preliminary data from public health says 3 cases on Guam were linked to overcrowded housing, 1 to a lack of indoor plumbing, and 7 were sporadic. Her advice to prevent the spread: wash your hands with soap, practice food sanitation, and good hygiene.
What we're trying to do is encourage the community to be really, really vigilant about hygiene and sanitation, especially if you are living in a crowded household, or your children go to daycare centers, or if you work at a daycare center, or if you have no indoor plumbing. If you're eating or preparing food, wash your hands. If you're changing diapers or taking care of little kids or kids who are sick, wash your hands. Don't swallow water when you're swimming out and are hiking.
Healthcare providers are urged to be on alert and report cases promptly to the Bureau of Communicable Diseases. Reporting for Guam's Network, I'm Carmen Victoria Terlaki.